Medicare's home health benefit provides home health care for patients that have an illness or injury. Home health is usually cheaper and more convenient than going to a hospital or skilled nursing facility. Although it's an important service, people are scamming the home health care program.
A doctor and 3 home health agency owners were convicted for their roles in a $375 million fraud scheme. As part of the scheme, patients were recruited from a homeless shelter to sign up for Medicare home health services, and recruiters were paid up to $50 for each patient. Nurses falsified medical paperwork to make beneficiaries appear eligible for services that just weren't medically necessary. Hundreds of home health agencies were connected to this fraud, and in addition to criminal responsibility, some now face administrative sanctions.
In fiscal year 2015, almost 60% of Medicare's payments to home health agencies were improper payments. That's over $10 billion. OIG found that more than 500 home health agencies and 4,500 doctors showed patterns of potential fraud. Most schemes involve home health agencies billing for services that weren't medically necessary or services that weren't provided. OIG also identified 27 geographic hotspots for probable home health fraud.
Although some of these areas aren't known for Medicare fraud, many of these hotspots also have high Medicare fraud rates. We're absolutely data-driven. We identify these regions because it's helpful and we can put the right resources in the right place to continue our fight against fraud.
Home health services fraud in Medicare and Medicaid is a priority and is a major portion of OIG's enforcement efforts.
By using data to find patterns of fraudulent activity and identifying geographic hotspots, we're chipping away at home health fraud. Doctors, nurses, and home health agency owners should know that we're tracking data, investigating fraud, and holding criminals responsible.